Good afternoon, everyone. Thank you for joining the session. My name is Chelsea Heyman. I'm from the Maryland Department of Disabilities. We're going to wait about 2 more minutes just to let people kind of get in and get settled. If you're having any technical difficulties, please type that into the chat. For my folks who are call-in, it looks like I have 2 people calling in. You'll not be able to talk unless I unmute you. So just keep that in mind. I have everyone on mute right now, so you should not be able to talk. You should, your microphone should be muted. What we're going to be doing is we will have questions answered at the end of the presentation. So during the presentation, though, you can indicate any questions you have in the Q&A. So I just want to make it clear that the Q&A box is for presentation questions. Technical difficulties, please put that in the chat. Or if you have like a colleague who's having a hard time getting into the webinar, they can also shoot me an email. I'll be monitoring my emails as well. So just FYI. So we have about 1 more minute left and I'll go ahead and start making introductions to our panelists. I'm always the one who is tardy to webinars, so I give a 5-minute grace period.
Me too, and for the exact same reason.
Yeah. Plus, I know people are just kind of getting back from lunch and everything. Okay. Looks like I'm still waiting on the transcriptionist. If the transcriptionist does not join by the time that we get started, I will go ahead and enable live transcript on this webinar. Okay, so the live transcript is on. You should be able to see that at the bottom of my screen. Robin, do you see that?
I do.
All right, excellent. Okay, well, good afternoon, everyone. Again, I am Chelsea Heyman. I work for the Maryland Department of Disabilities, and I am the Director of Housing Policy and Programs for the department. I am joined by an expert panel today of people to talk about a combination of different housing-related issues with a discussion focusing specifically on fair housing, on healthy housing, and also housing needs for older adults and people with disabilities, and renters insurance. So we're going to cover a lot of different information as part of this, this panel. So we appreciate you spending your afternoon with us. So this presentation is made possible through the Department of Disabilities and the Maryland Insurance Administration. So I want to thank my colleagues at the Insurance Administration for being so gracious to set this up and to really you know, push this out to the masses. So I appreciate that. We're going to start off this afternoon with Robin Dorsey, who is the Fair Housing Director for the Fair Housing Action Center of Maryland, which is under Maryland Consumer Rights Coalition. So Robin's going to be talking to us a little bit more about fair housing and giving us a 101 introduction to fair housing and what that means. So Robin, please take it away.
Thank you, Chelsea. Could you give me permission to share my screen?
Yes, ma'am.
Thank you. So as Chelsea said, my name is Robin. I am the Fair Housing Director at the Fair Housing Action Center of Maryland, which works to ensure that every Marylander has access to safe, affordable housing free from discrimination, harassment, and code violations. We are a program, as Chelsea said, of the Maryland Consumer Rights Coalition. And before I dive in on some of the fair housing work, I wanted to talk a little bit about 2 other programs at my organization. The first is our Tenant Advocacy program. And that is headed by my colleague, Carol. And this program is fantastic. Basically, any kind of housing issue that you may be facing, if you're renting and you're unsure of what your rights are as a tenant, or you think your landlord is doing, should be making repairs that they are not, if there's code enforcement issues, Carol is going to be able to connect you to the information you need, connect you to help to resolve any problems directly with your landlord or your property management company. She can help you to prevent evictions, to know where rental assistance might be available. Just any housing question you have, Carol can help you figure out how to solve it. And she also provides that service to landlords. So if you are a landlord and you're not sure what your responsibilities are under the law, Carol can help you with that as well. Our other program is our Soar program, Securing Older Adult Resources. This is a really phenomenal program some of you may be familiar with. It has sort of 5 main pieces. First, we help folks with the renter's tax credit. This is a tax credit specifically designed for older adults and people with disabilities and some other groups to help offset the costs of your rent. That is generally available to folks who are over 60 who are permanently disabled and spend more than a certain percentage of their income on rent. It's a bit of a sliding scale depending on how much your rent is and how much your income is. But if you call the number at the top of that slide there, 443-961-6220, our counselors will screen you and tell you whether or not you're eligible and then help you file the paperwork to get that renter's tax credit. There's also the homeowner's tax credit, which is similarly designed. So it's also, really targeted towards older adults and people with disabilities. That one's a little bit simpler to know if you qualify for it. If your household has less than $60,000 in annual income, then you probably qualify. While you are working with our SOAR counselors on either your renter's tax credit or your homeowner's tax credit, they would also do a benefit checkup, which is to make sure that you are receiving all of the government benefits you're eligible for. Last year, they were able to, through benefit checkups to older adults, they were able to capture more than $150,000 in benefits for participants in our program. So that's can be a really big impact on your bottom line. And then SOAR also provides financial counseling. If you have a financial crisis of some kind, they will help you to resolve that. And then if you have a goal that you'd like to meet, like buying a home or moving or paying down debt or any of a wide variety of goals, we have financial coaching that will help work with you over time to break that goal down and figure out what you need to be able to meet that goal. So that those are great programs that I highly recommend. I wanted to get that out there at the start, and then I will dive into the meat of my presentation, which is about fair housing. We unfortunately do not have nearly enough time to go into the entire history of fair housing. The extremely long story short is that for decades, white people passed laws and did other things that resulted in the segregation of housing. And after, as part of the civil rights movement, the Fair Housing Act was passed in 1968, and it was intended to end housing discrimination. It defines housing discrimination as any attempt to prohibit or limit free and fair housing choice based on membership in a protected class. So nobody should be receiving different housing based on who they are. A protected class just is a way of describing a category of people. So the protected classes that are laid out at the federal level are race, color, national origin, religion, sex, familial status, that's whether you have children or not, or disability. The state of Maryland then adds some additional protected classes. In the state of Maryland, we've also recognized marital status, sexual orientation, gender identity, and source of income as protected classes. I've got source of income there in red because that is a brand new protected class. There are also locally protected classes. Those do not always make a difference sort of in your day-to-day because they're enforced at the local level, but I did want to flag that there are other aspects of other protected classes that are protected from housing discrimination. So source of income is that brand new protected class, and that is because the Home Act passed here in Maryland just last year. It went into effect in October. HOME stands for Housing Opportunities Made Equal. And what that means is that no matter how you pay for your housing providers may not treat you any differently. The main problem that this was trying to solve is landlords and property managers refusing to rent to people who have housing vouchers, maybe a housing choice voucher like Section 8, it's often called, but that would also include veterans vouchers. There's lots of other small vouchers out there. Now with this new law into effect, housing providers, landlords, property managers must accept those vouchers as payment. They also can't treat voucher holders any differently because they have a voucher. So they can't say, oh, you have a voucher, we're putting you into our unrenovated apartment in this older building that's out in the back area. They also similarly can't say, we really don't do maintenance on the apartments rented by our voucher holders. They need to treat voucher holders the same as they treat all of the other housing consumers. This source of income class also protects people who may pay for their housing through Social Security or retirement income or disability income. That is not an uncommon problem to some of you may have experienced in the past, to have a landlord who isn't accepting Social Security income, or even sometimes student loan income is another type of problem or another type of income that might be rejected. So this new law has just gone into effect, but I am a strong believer that you only have the rights you know you have. So with this new law, we are working really hard to reach voucher holders and people with Social Security income and anybody else who may have experienced discrimination based on how they pay for their housing, to let them know that they have this new housing right. And particularly for voucher holders who may have been or have been really sort of segregated into specific neighborhoods, into specific buildings because of landlords discriminating against them. Now that that has been banned by the law, voucher holders should feel free to move into different areas if they want to. And so we are really trying to get that information out far and wide so that folks know about the rights that they have. There are also rights. We discussed one of the protected classes is disability. So if you have a disability, you landlords, property managers, housing providers are not allowed to treat you any differently in housing because of that. But there are also additional rights that you have beyond those sort of basic fair housing rights. And those are intended to make your housing work for you just the way that housing works for people who don't have disabilities. And so those disability rights come into sort of two main components. They fall called reasonable accommodations and modifications. So a modification, a reasonable modification, is a physical change that you might make to a housing unit in order to make it more accessible to you. So one of those differences could be adding grab bars in the bathroom or in other places, having chair lifts on stairs, or putting ramps in, or even if you have a visual disability, having doorbells that flicker the lights instead of, or sorry, not a visual disability, an auditory disability, having doorbells that flicker lights instead of ringing a sound. Those types of things are all modifications that can be made to a unit to make it more accessible for you. And housing providers, landlords, property managers are required to make those, to allow those modifications to your unit if you request it. You can request a modification at any time, not just when you first lease the apartment or not just when you first move in, but at any time. If you need a modification to a unit to make it more accessible for you, you are allowed to request that, and the housing provider is not able to say no, as long as it's something that can then be undone for the next tenant, as long as it doesn't permanently change the unit. There is one catch, that tenants are responsible for paying for any of those modifications, but there are funds that can help pay for that depending on the location that you're in. The reasonable accommodation is similar, but an accommodation, instead of being a physical change to a building, is about changing a policy. So one of the most common policies we see changed, or accommodations we see made, is allowing, if an apartment doesn't allow pets, or they do allow pets, but there's a special pet fee, and you need a service animal, then your the accommodation would be either to allow the pet or to waive the pet fee, or both, in order that you can have your service animal. That's the biggest kind of accommodation. The accommodations must be reasonable, so they can't cause undue financial burden to the housing provider. One example of an unreasonable request for an accommodation that I've heard is a building where there had been a restaurant on the first floor, and many people who were disabled in the building used the restaurant as a way to get meals, but the restaurant was sort of separately operated, and when it closed, the people in the building asked that another restaurant be there, but that's beyond the scope of what you can ask for in an accommodation. That's an undue financial burden to require a business to operate somewhere. But broadly, there are lots of accommodations that you might need and might request, and again, just like modifications, they can be asked for at any time. And as long as it's not an undue burden on the housing provider, they must say yes. So if you, based on this, think that you or someone else has faced housing discrimination, or maybe you just have some additional questions, I want you to be able to get in touch with me. So we have, our website is www.fairhousingmd.org. And you can also call us to ask a question. That you can also get to our housing helpline this way. But if you think you may have been a victim of discrimination, or you just want to ask some more questions, you can go to our website or also call us at 443-447-7336. I really encourage you, even if you don't want, even if the discrimination might have happened ages ago and you don't think you can, there's nothing to be done about it now, or it didn't happen to you, but you did see it happen, and so you can't file an official complaint. We are only able to enforce fair housing laws when we know what's happening out there. So we rely on you to be our eyes and our ears, and just the information about what's happening, what you've experienced, really helps us to do our job. So that's the key way that you can fight housing discrimination, but there are some other ways as well. One, like I said, that new law just passed this past year. It passed because advocates, people like you, came down to Annapolis and shared their story. This past year, it was really the Home Act passed because, in large part, the testimony of a veteran who shared her story of having a voucher and yet being unable to find housing and being homeless because of it. And it was her sharing of that story in Annapolis that was sort of the final push that helped that bill to pass. So that that advocacy is so important. I also would love to get your help in spreading the word about fair housing rights. Like I said, we only have the rights we know we have. So we need to get this information about fair housing rights out far and wide. And if you have, if you know someone who has a voucher, pass the information on. If you have a church group, community group, a knitting group, any group of people that gets together, I would love to come and present about your fair housing rights and what to do if you think they've been violated. I love doing these kinds of presentations all over town. And then finally, you can prevent fair housing by becoming a paid fair housing tester. This is a contract gig. You can do it in the on the weekends or during the week is great. If you do it during the week as well. We pay $150 to our to people who become trained certified fair housing testers. That takes about 10 hours total. And then for each test that you complete, which is basically making a phone call and then writing a report about it, for each test that you complete, we pay you $50. So it can be a good side gig to make some income. But while you're doing it, you're also helping to uncover fair housing discrimination. I know fair housing testing might sound a little vague. It really just means mystery shopping for fair housing. What I'll do is I'll send you to go and rent an apartment, and you aren't renting it for real, and you're using sort of a fake identity that I give you, and just reporting back what happened when you tried to rent that apartment. What did the housing provider say? What information did they give you? It's very simple. If you've ever rented an apartment before or ever shopped for housing before, you know exactly how to do this. The only extra thing that you would be doing is writing a report afterwards to tell me all about it. So if that sounds interesting to you, you can follow up with me in any of these ways, emailing me at robin@marylandconsumers.org. Or if you would like to talk, that link there, calendly.com/Robin Dorsey, also will get you, will let you put a meeting straight on my calendar. Or just a reminder to either report discrimination or to get housing help, you can reach us at fairhousingmd.org. And I will leave it there. I see there were some good questions in the Q&A, so I will try to answer them, but we will also be around for the Q&A at the end of the session.
Great, thank you, Robin. So yes, it looks like we have, okay, looks like we have 5 questions in the Q&A. Are you good to take on those, Robin?
Yeah, I will give them a look, and I will see what happens.
All right, very good. They all look like they're fairly specific as well. So, so great, wonderful. I'm glad to see that we have some engaged participants.
Yeah, that's great.
All right, so moving along in the agenda here, I am actually the next presenter. So I feel like I've already introduced myself a couple times, but if you're just joining, I am Chelsea Heyman. I work for the Maryland Department of Disabilities, and I'm going to be presenting on housing programs for people with disabilities with a specific focus on the housing programs that my department oversees. So I'm going to pull up my PowerPoint here. And get this started for everybody. Okay. All right, great. All right, so The Maryland Partnership for Affordable Housing. This is a collaboration of state agencies. My agency, the Department of Disabilities, the Department of Health, and the Department of Housing and Community Development. We oversee several affordable housing programs for people with disabilities that are operating in the state. Some of these programs are through HUD funding, and some of them are through private funding, as well as partnerships with local governments. So I will go through those and kind of give you some background on what is available now, and also how you may access the programs through applying to be in our waitlist registry. All right, so just an overview of my presentation here. I'm going to talk a little bit about the housing landscape in Maryland, focusing on people with disabilities specifically, our current initiatives, new initiatives, and I'm also going to talk about requesting accommodations and modifications. I'm likely not going to spend a lot of time on that subject since Robin spent a good bit of her presentation also going over that. So I will go through those slides, but if you have any specific questions, you're welcome to pop those in the Q&A. All right, so this slide is essentially giving you an overview of housing affordability and what that looks like in our state. So a person with a disability, typically, if they're not working, then they might be receiving SSI. And SSI is currently at $794 a month. So when you look at that amount and you try to compare that against the average monthly rent for a one-bedroom apartment, you can see that the amount of SSI is simply not adequate to be able to pay for rent every month. In fact, there's no housing market in the United States in which a person who's living just on SSI can afford to rent a safe and decent apartment without some kind of rental assistance, whether that be a voucher or a subsidy program. So that's pretty significant. And it's certainly something that, you know, our department's always striving to do more and expand using the resources we currently have. However, it's also a matter of those resources being available at the national level, and you know, there for us to apply for and to access in some way. So it's certainly advocacy on both ends. There's two good reports actually that this slide references, and I will send out links. I'll put some links in the chat for those who are joining by computer to these reports after my presentation. All right, so the HUD 811 Project Rental Assistance Program, go through some of this information here. So we have received 3 grants from HUD for this program. Our initial grant was in fiscal year 12, and then we received subsequent grants in fiscal year 13 and fiscal year 19. Essentially, our overall goal is to identify 400 permanent supportive housing units. The total funding for this program is $27.9 million. Currently, we have 322 of those units identified. The goal of the 811 program is to provide integrated living in the community. So our focus is identifying buildings that are in affordable housing buildings throughout the state, where we can have units that are, it's no more than 25% of those units designated for a person with a disability. So the goal, the reason why that is the goal is because we want to ensure that a person with a disability who's transitioning out of an institutional setting has an opportunity to live in an environment where it is not mimicking the institution that they are moving out of. So we really want to give people an opportunity to feel like they're living in the community, to know that, you know, they have neighbors of different backgrounds, different experiences in life, and really to give them a sense of being reintegrated and used to living in a community environment after potentially spending many years in an institution. So eligibility, to be eligible for this program, You have to be between the ages of 18 and 62 at the time of leasing. You have to meet the HUD definition of disability, and I'll put a link in the chat as well to that definition if you want to take a look at it. You have to be a Maryland Medicaid recipient and eligible for long-term supports and services. Now, what long-term supports and services are essentially any of the Medicaid waiver programs, as well as some of the DDA waiver programs. You might be receiving supportive services through a Center for Independent Living. We do have a list of what that might entail. So there's we have a comprehensive listing that I can certainly provide as well to participants of the webinar. Your income has to be at or below 30% of the area median income. Now, that is for the jurisdiction where you indicate that you want to live, so that's important. And I'll explain a little bit more about our wait list later in the presentation and how we categorize that information in that system. Your tenant rent contribution for this program is 30% of your income for rent and utilities combined. So what that means is that you're not paying more than 30% of your income on rent and utilities. So the subsidy that is part of this program pays the remainder, essentially. All right, so these are our priority groups for the program. Our first priority are people who are institutionalized and are Medicaid recipients, people who are at risk of institutionalization, maybe because they live in substandard housing, individuals who are moving to independent renting. So this could be someone who is in a residential rehab program licensed by the Behavioral Health Administration. Could be an individual who is on the brain injury waiver, living in an assistive living unit. And in addition, our fourth priority is going to be people who are experiencing homelessness and who are Medicaid recipients. And you can see here that there's a couple different orders, but essentially with our waitlist software, this is one group in and of itself. So our priority 4 group are individuals experiencing homelessness, and then it's broken down into more details based on living situation. All right, so this gives you a sense of where our units have been located for the past 3 grants that we've received from HUD. Our first grant only covered the Baltimore and Washington metropolitan statistical areas, so only the counties that make up those 2 areas. Our second award is statewide, and the third award actually designates 80% of the units in the Baltimore, Washington metropolitan areas, and then 20% in the remainder of the state. So far, our program has housed 257 individuals since we started. Majority of individuals have been transitioning out of an institutional setting, and majority of the applicants have been people reporting a physical disability, with behavioral and then developmental coming next after that. 154 people have reported a need for an accessible unit. And in our program, we do the best that we can to work with property owners to access those units that are set aside for a person who might have a physical disability, simply because we want to make sure that we have those available for people on our program in the event that they need it. Okay, so the unit selection process, how we select units for this program is dependent on the buildings that have received affordable housing funding from the state's Department of Housing and Community Development. So these are buildings that are in the low-income housing tax credit program. So some of these are rent-controlled buildings where, they're intended to be for people who are at moderate to low income individuals. So we look to identify units in those buildings. That's a requirement of the program. So we work with our partners at the different state agencies, as well as the centers on independent living. So we talk to them and get a sense of what their consumers are looking for. We also try to look to our wait list to see where the demand is. We want to make sure that we're locating units in buildings that are closer to things like public transportation, shopping, adequate sidewalks, and things of that nature. And we also want to make sure that we're looking at the unit sizes based on the demand on our wait list. So we tend to have more individuals who are interested in a 1-bedroom unit than a 2-bedroom unit. This program currently in the first 2 grants does not allow for units larger than those 2 sizes. So we really rely on the data that we have on hand, as well as input from our partners, to decide when we have new funding available for the program where we want to locate units and what buildings are best for the program. Okay, so the Weinberg Apartments program is a separate program, but similar to 811 in the sense that these are units that are located in affordable housing developments throughout the state. The income requirements are a little bit different, so you do have to have some income to qualify for this program. The first grant was 15 to 30% of the area median income. And the second grant was 10 to 30% of the area median income. Looks like I have somebody who raised a hand. Laquana Simmons.
I was just trying to find out about enrollment in the programs.
Yes, ma'am. So I will get to that. That's gonna
Okay.
be my last couple slides.
Gotcha.
Yeah, sorry about that. Great, good question though. All righty. So we did receive additional funding for this program as well from the foundation, and there are some new priority groups that are included in the new grant. Okay. As you can see, the eligibility here, very similar to 811, ages 18 to 62. The gross household income requirements are listed there. 2 things I do want to bring up that are part of the criminal background screening for both programs. You cannot have a lifetime sex offense registry marking on your record. And you also cannot have been convicted of producing methamphetamine on federally assisted property. Those are HUD rules. So that is going to be universal. All right, so the first 2 Weinberg grants, these are the priority groups that were identified for that, for those grants. You can see here that, you know, we're looking at, for priority consideration, looking at people who have needs for accessible housing, perhaps multiple disabilities, looking also at the readiness of that applicant to move and when they were added to the wait list. And I do want to mention that when I'll mention this later in the presentation, but we always look at our wait list based on the time date stamp of the application being added, as well as the priority group. So there's actually a way for us to look up people based on those 2 factors, and it's automated. So we don't have to do any sort of sorting or anything of that nature. The system does it itself. Our third Weinberg grant, these are some of the priority groups that the foundation identified for this grant. Transitioning youth with intellectual and developmental disabilities, 18 to 35, living with an aging caregiver in a group home setting, or transitioning from permanent supportive housing, individuals or families who are homeless, as well as youth aging out of foster care, who are disabled and homeless or at risk of homelessness. Okay, so this will get to the question that was asked. So how to refer an applicant? I do want to make it clear that in order to apply for this program, you have to have the assistance of a case manager. If you have questions about how to get in contact with a case manager, I'm happy to answer some of those questions. I'll share some resources in the chat after my presentation. However, if you are receiving some kind of waiver service, you might be getting the assistance of a supports planner They can help you with applying for the program. You might be getting help from a coordinator of community service if you have an intellectual or developmental disability, and other types of case management services. The Centers on Independent Living, you might have an advocate helping you with that, with other resources at that center. So that individual, give them the link to this website, www.socialserve.com. And they can register and set up an account and then start screening you for eligibility for the program if you're a consumer of services. All right, so these are the questions that are asked in the pre-screening. We do ask for the Medicaid number. That does have to be entered in correctly. That is checked by the Department of Health. If it is not entered in correctly, you will not qualify for the program. And we need all of that information before an application can be successfully entered. We do want to know what counties you're interested in living in. So there's a limit of 5 counties that you can designate in the system. And so that information will be important for us to have when we look at our wait list and when we have a new property that becomes available. The current living situation is another important piece of information for us to have. Those priority groups I mentioned earlier, those are different living situations. So when we screen for eligibility, our system automatically sorts, if there's a new housing opportunity that comes up, our system will automatically sort people based on the time that they put the application in and their current living situation. And we search based on the bedroom size that's available, as well as the county where that unit is going to be available. And that's how we get our list of people to contact. We contact the case managers, not the applicants, because their information is in the system. So we reach out to the case manager, we give them information on how to get an application together for that property. And from there, that's when we take in the information and share it with the property manager as part of the leasing process. This kind of goes over what I was just talking about, the leasing process. We refer more applicants than there are available units. We do that because we know that in the application process, it's possible that somebody might not meet all the screening criteria. They might not pass the credit check. They might not pass the criminal background check. So these property managers, they're usually under a deadline by which they have to lease all of the units. So that's important. And normally what that means is we have to provide them with as many applicants as we can in order for them to make sure that that unit is leased by a certain date required by their contract with the Department of Housing and Community Development. So as I mentioned earlier, this is how the selection process works for both the 811 and Weinberg programs. All right. Now, it's important to say that the property manager conducts a separate application review and approval process. This is what they're looking at. They're looking at credit, criminal background, rental history, EIV, which is electronic income verification. So they're going to be checking and making sure the income information you provided is correct. If it is not correct, that is an issue. You would not qualify for the program. And they do a third-party income verification as well. Yes, prompt responses are crucial. So with the case manager that you're working with, or if you are a case manager, you will be given deadlines by our team. If your applicant is up for consideration for a housing opportunity, respond to our messages as quickly as you can, because we're looking and checking for people to be able to move in on time to that building. Approvals and move-ins. So this just kind of explains the process of after somebody is approved to move into an apartment. We provide the property a list of referred applicants based on that priority order I mentioned earlier. So they are aware of the order in which they can offer the unit to a person based on what our waitlist system has stated. So I'm going to try and touch on this briefly because I don't want to go too far over my time here. We have 2 other programs that are new initiatives. The Community Choice Homes program, that is exclusive to Montgomery County. That is a project-based rental subsidy program, not a voucher program. That program in particular has a live-work preference, meaning that applicants have to have lived or worked in the county at the time of referral, or lived or worked within 5 years of referral and currently live in an institution or group home setting. So that is another program that when a case manager enters an applicant's information in our registry, they will be screened for this program. So it's not like a separate application. They're screened for eligibility for this based on the criteria that the county has put into this program. Disability income housing units in Howard County, this is also very new. We're just getting this started, so we haven't really rolled everything out with this yet. But what this does is it creates affordable units and projects for people with disabilities who are living at an income of 20% of AMI or below. So this program is brand new. We're still working on getting this started. Okay, so I'm not going to spend too much time on this actually because Robin already presented on this. Here is our general housing email address and our department's phone number. So I will monitor the chat box and just answer any questions I'll send some general information in the chat box and answer any questions I see in the Q&A so we can get rolling along with the presentations. And I'm going to try and stop sharing. All right, there we go. Okay, well, thank you, everybody. I believe we are on to Ms. Chevelle from Green and Healthy Homes Initiative. She is their outreach and education manager, and she is going to be presenting on healthy housing. Take it away.
Thank you so much. Let me just share my screen. All right, can you see my screen clearly?
Yes, ma'am.
All right, thank you so much. Good afternoon, everyone. Again, my name is Chevelle Bash, and I'm the Outreach and Education Manager here at Green and Healthy Homes Initiative. Today, I'm going to give you a brief overview on how to recognize the connection between housing and health, and how to identify housing hazards linked to the 8 principles of a healthy home. Before I begin, I wanted to give just a brief history on Green and Healthy Homes Initiative. We was originally founded in 1986 as a parent advocacy group. And that effort grew into the Coalition to End Childhood Lead Poison in 1993. And in 2008, we transitioned to Green and Healthy Homes Initiative. Now, Green and Healthy Homes Initiative was created to provide innovative programs to improve the delivery of services to ensure that Maryland families are being educated and are able to receive housing improvements such on lead hazards, asthma, and the reduction of falls, slips and falls within their home. At Green and Healthy Home, we have a motto of breaking the link between unhealthy homes and unhealthy families, improving the health and quality by remedying home-based environmental health hazards that impact the family, such as I mentioned before, with the asthma, lead poisoning, and household injury, is one of our key factors, because a healthy home is one that is marked not only by the absence of health and safety threats as it was built, but one that will provide a nourishing environment for your physical and mental health and well-being as well. So many homes have unhealthy conditions. And as I go through my presentation, I will talk more about how most unhealthy homes have water leaks, structural problems, lead-based paints, and they also may have some poor air quality due to pollutants such as secondhand smoke and things of that nature. Families living in an unhealthy housing condition can be spending 14 to 20% of their monthly income on their utility bills alone. These unhealthy conditions can cause adults to miss work and children to miss school as well. And that is one of our key factors to try to educate families and to assist them with remedying any situation, whether you're a renter or a homeowner. And Green and Healthy Homes Initiative would do an assessment to come in to the home to see if there's any issues or concerns that could affect the family's health as far as lead and asthma triggers. Some benefits of keeping your home safe would be will help you increase in your work and school attendance. And it will also help decrease in healthcare costs, taking your child back and forth to the doctors a lot, or you missing work because you're not feeling well due to the poor air quality or due to some hidden health hazards that may be in the home that you just haven't recognized. Your home is a system, and that has several components that are designed to protect you from outside elements. But as a result of this protection, it can cause some wear and tear on your home. Even if you're in an apartment, or even if you're living in a detached or attached single family home. Now, the 8 principles of healthy housing that I'll be going over today is as listed, to keep your home dry, to keep it well ventilated, to keep it safe, to keep it contaminant free, to keep it pest free. And pest free is one of the biggest concerns of some of our clients with rodents and roaches, mice, rats, and things of that nature inside and outside of the home, keeping it clean and well maintained and energy efficient. And I will briefly touch on those points as well. Now, the first is keeping it dry from moisture and mold. Your house may have mold that you haven't noticed as of yet, and this mold could be observed by stains or discoloration on the walls or ceilings, or either on your furniture due to moisture from leaking ceilings and things of that nature. Another sign to look out for is damp or musty smells around the house. You should always keep an eye out for water stained or coloring or any type of fuzzy growth that could be growing on the ceilings or walls or baseboards, because this can be a cause for asthma triggers as well. And it also could be a breeding ground for roaches and rodents. Another detection that most renters and homeowners should look into is your gutters and downspouts. This could be a cause for your roof in your home to have mold in it, or any type of clutters within the downspouts where leaves from trees have accumulated on a regular. This can cause water to back up into the home. Now, if water backs into the home, it could cause leaks within your windows. You can have a leaky basement. Sometimes the foundation of the home, due to normal wear and tear, could have cracks in the basement. And by this water coming into the home, it will cause a lot of moisture in your basement area that's coming in through those cracks. And if it's not noticed in a reasonable amount of time, it could cause mold within the home. Now, plumbing leaks, excess water can be a very big issue. Water leaks can change the indoor air quality of the home, and a number of leaks from a sink or pipes is like someone pouring a bathtub of water being dumped into one area of your home, and that sitting moisture can cause mold and poor air quality. And number two is to keep it well ventilated. We spend 70 to 80% of our time indoors, especially due to the COVID pandemic, and the indoor quality of air is very important, especially if you have seniors, older adults, and children within the home. They could develop asthma symptoms as well. So to keep a good ventilation in the home is key. And as I go forward in the presentation, you will see some of the options to do so. Now, combustion components. Now, some families may use an oven as a heater, and they might have spillage within their furnace or water heater. These type of heating options can cause carbon monoxide poisoning, and that is a odorless and colorless gas, and that carbon monoxide can be dangerous to a family. And nowadays they have new carbon monoxide alarms that have an ion battery that lasts for at least 10 years. So it's best and safe to go to any hardware store to collect those for your family, to make sure that you locate them in areas where your family is sleeping on a regular basis so that they can be protected just in case, because you never know when carbon monoxide can be leaking within your home. And your home will get fresh air in the coolest months by using a maintenance HVAC system, which and make sure that you change your filters within this system so that all the mechanical ventilation can be circulated throughout the home, whether it's in your bathroom, in your kitchen. Try not to smoke inside the homes. Smoking inside the home can change the air quality, even if you do have a regular change filter within your heating system. So it's always best to smoke outside the home if you have to smoke, but I would suggest just to try to stop smoking. Another option is to keep your home safe. Accidents are caused in homes more than a lot of us realize, and a lot of these incidents is due because of poor stairways, the way that they was built. If you're in an older home, some of these stairways can be steep, loose railings within, outside and inside of the home. And Green and Healthy Homes Initiative do an assessment for our seniors over 65 to make sure that their home is safe and the railing systems is tightened. And also if they have air conditioners within the home that's being held up by poles or sticks on the outside, that can be very dangerous as well. Child safety is very important. If the home have children, especially toddlers that's just starting to work and walk and be more adventurous, it's best that families make sure that they have cabinet locks. And if you have an infant that's in the crib, try not to put that crib by a window that may have a blind with a string, because that could be dangerous for a child as well. And as I mentioned before, walking toddlers, they can get into cabinets under the sinks, whether it's in the kitchen or bathroom or in the basement. It's best to have cabinet locks to ensure that your child will not be overwhelmed by these poisons, because the first thing that they will do is put these items in their mouth. Fire safety is always important, as I mentioned before, to have a carbon monoxide alarm near sleeping areas. And it's also important to have a fire detector and an escape plan as well. Now, some fire hazards could also come from your dryer system. When you're washing clothes and drying clothes, a lot of families forget that that dryer do have a venting system that needs to be cleaned out on a regular, because the dust and buildup from and lint from your clothes can pile up within these pipes, and it can also ignite a fire. Some other hazards are your electrical hazards, exposed wires, missing or poor condition electrical outlets, hanging light fixtures. This can be a fire hazard, and a lot of homes that are currently doing reconstruction or remodeling, sometimes they may fix some items but leave these items open. It's always best to have these covered. The slip and fall happens often in homes, mainly due to, as I mentioned before, steep stairways. And as you see in some of these pictures, a lot of stairways may have cords that are blocking you walking down these stairs, and you can trip and fall. Some walking to your home, to the doorway, they are cracking cement that can cause a person to trip and fall as well, and also steep stairways. Now, these stairways in this picture looks a little moist, and this moisture could be coming from a leaking ceiling that the homeowner or renter may not have noticed. Keep your home free of toxins. Lead, asbestos, radon, volatile organic compounds, pesticides, and that environmental tobacco smoke can mess with a house or apartment's air quality. So it's always best to check for these items. Now let's talk a little bit about the lead-based paint. A lot of homes that was built prior to 1978 may have lead-based paint within them, in the doorways, the windowways, the walkways, the baseboards, and this is coming from the chipping paint, and it may look like an alligator skin pattern within these homes. At Green and Healthy Homes, we do come out and do assessments for this. So that peeling, chipping, and flaking paint could be found again inside or outside on the banisters, the porches, floors, and baseboards as well. And we also check for asbestos. Now, if the asbestos is contained properly, then it does not cause any type of damage to the home. But if it is bothered or messed with, it may be feasible to remove it at any given time. So that is also a hazard that is checked off. So the volatile organic compounds that I mentioned before could be the paints, the paint strippers, cleaning supplies, pesticides, which you use to get rid of the roaches and rodents, graphic craft materials such as glues and paints. And a lot of people are doing a lot of painting and crafts during the COVID time. So it's best to always read the labels on these products to make sure that they are safe to use around your family. And the pesticides, if a family member comes across pesticides, they could cause you to have an irritation within your throat, your eyes, your nose. It could cause nausea as well. And if it's undetected and exposure is during a long period of time, it could cause health issues as well. The environmental tobacco smoke is also one to be careful of, especially if you have members of your household that may be pregnant. Secondhand smoke can cause them to miscarry. It could also be an asthma trigger and can cause cancer as well. Keep your home pest-free. A lot of older homes that may be, if you have a house that's cluttered, it's always best to clean the clutter, dry the areas in which there may be moisture, because this type of stuff will breed roaches and rodents within the home. And I just pictured some signs of the infestation. It's always best to keep your home clean and clutter-free, as I mentioned before. because due to a lot of clothes hanging around. So if you wash your clothes, it's always best to fold them and put them away first. And it's always best to tighten up your food and wash your dishes before you go to bed at night. Always clean those areas in which rodents can make a home. Keep the house well maintained. Your furnaces and ventilation systems, change those filters. Check for safety devices such as your smoke detectors and carbon monoxide. Clog up any holes that you might have inside or outside of the house, and always try to get your gutters cleaned out on a regular basis. Number 8 is to make your house energy efficient. And to make your house energy efficient, the Home Depot and other supply stores, they have energy efficient light bulbs that you can use. If you do not have hot water heaters or tanks and things of that nature, it's always best to have an inspector come out and utilize some of the programs that the state may have in order to get these items replaced, especially if you are a homeowner. So the 29 healthy home rating system that we just went over is to keep your home dry, keep it well ventilated, contaminated free, pest free, keep it well maintained, keep it safe, and keep it clean. And some other resources that I wanted to go into, the Healthy Homes for Healthy Kids program that's provided by the Maryland Department of Health is always a good option when we get calls from Green and Healthy Homes. If we have families that meet the criteria, we will do the referral ourselves. And there's also a lead hazard reduction grant and loan program that is available through the Maryland Department of Housing and Community Development. And all you have to do is be a Maryland resident, and there is no income limit for this. They just need to make sure that you're able to repay any expenses that may need to be paid back during the time of the assessment. And you have to be living in units that was constructed prior to 1978 as well. So at Green and Healthy Homes Initiative, when you give us a call, we'll be more than happy to do an assessment. And we also have programs for our seniors 65 and over. And that's our Agent in Place program, where we replace banisters and assist with replacing of windows and carpets and floorboards and things of that nature. So we will do an assessment for that, as well as we provide legal services for our renters. So if they're having issues with their landlord as far as getting their house lead free, or if their children has been tested for lead, we assist with that as well as putting your rent into escrow. So if you're interested, you can feel free to give us a call and we'll be more than happy to do that assessment, or also email us if you would like us to come out and do tenants' rights presentations. Well, we're doing it virtually now. And we also have our property owners training that will give an educational outlet for our property owners, so that before they rent a home, they will know what upgrades and things like that they need to do in the home, and certifications that they will need before they rent their home for family. So that's all I have for me. And here's my contact information. So if you have any questions or anything for me, feel free to email or give me a call as well.
Great, thanks, Chevelle. We did get a question in the chat that I wanted to post at you, Chevelle, because it seems interesting and relevant. TY asked, I would like to know about how to shop for and select new flooring options that are green and will not gas off VOCs, how to test for mold in a home, testing for radon. If mold and radon is present, how do we find a reputable and honest remediation service? Oh, you're on mute, Chevelle.
Sorry. So in testing for mold, there are kits that are available, and Green and Healthy Homes Initiative do have a supply of kits that we can give or come out and show how to use them. So we do have some kits for mold and radon as well, and you can also purchase them within some of the local hardware stores as well. And what was the other part of your,
They wanted to know new flooring options that are green and don't give off VOCs.
right, most of the flooring options that are available for when you're doing home renovations, they do have it labeled. So you will see that it will have one of the green logo on it. So you know it's a safe product to get, but I always suggest people to go on the state website just to make sure that when they're purchasing items to investigate it further. But most of the flooring options that are available for green do have an indication on the label.
Great.
And I'll type it more detail in that. I see it.
Oh, you see it.
Yeah.
Okay,
And
great.
provide links as well.
Sounds good. All right, so moving along, our final presenter of the day is Miss Gia Wilkerson. And she will be talking about renter's insurance and why it is important. So I will let Gia go ahead and take it away.
Chelsea, it's actually me, Patty Dorn.
Oh,
FYI.
okay, sorry.
As long as I can share my screen, I'm good.
Yes, you should be able to. If you can't, let me know. Oh, yep, I see it.
Do you? Where did it
I
go?
do.
Okay, great.
And continue, any questions while Patty's getting set up, please make sure you put your questions in the Q&A. If you have chat related to just, general comments or technical difficulties that you're experiencing, please put those in the chat. I'm trying to monitor both, so my apologies, trying to stay on top of both things.
Thanks, Chelsea. Wow, there have been some really, really great speakers and great information today. I'm going to keep mine at about 10 minutes because we are getting kind of toward the end, and I want to make sure that people have an opportunity with the Q&A. So to introduce myself, my name is Patty Dorn, and I'm going to be talking to you about renter's insurance today and why renter's insurance is important. And there isn't a program available to help you purchase the renter's insurance. And so the renter's insurance is going to be something that renters do need to purchase, even if you're low income and you're interested in purchasing renter's insurance. But I'm here to give you the information to show you that it can be affordable to some, and it does protect your belongings. And the important thing to know is that your landlord's policy is not going to be protecting your own things and your own belongings. And so especially if you are somebody who does have a lot of valuable items, and that's a lot of us now with technology and such, it is just something to be aware of. It's something to educate yourself about. And so with that, renter's insurance, just saying that I'm not providing any legal advice here. And so the state agency that I'm with is called the Maryland Insurance Administration. And what we do is we enforce the insurance laws in Maryland. And so that's going to be Maryland laws with regards to insurance, any applicable federal laws. We license the insurance companies and we license the agents and brokers. And then we make sure that those companies that are in business in Maryland have the money to pay the claims. That's monitoring their solvency. And we review the policies that are issued. And we also make sure that the rates that are charged to you, so the premiums for your insurance, that it's not inadequate. And so that we make sure the insurance companies are collecting the money that they need to stay in business, but that those rates are not excessive and that they're not unfairly discriminatory. So they don't discriminate against a group of persons. And we also investigate consumers. So that's you. We investigate consumer and provider complaints and allegations of fraud. And so that's going to be if you're having a problem with an insurance company, an agent or a broker, or the state agency that you can contact for assistance or to file a complaint. So that's Maryland Insurance Administration. And that is important to remember. People do kind of sometimes get the feeling when it comes to insurance that they're out there on their own, that it's just them, you know, and the insurance companies or the insurance agents and brokers. And that's not the case. You can contact us even just with your questions. And so what is renter's insurance? So if you rent an apartment or a home, your personal belongings will not be protected against loss or damage unless you have a renter's insurance program, or unless you have a renter's insurance policy. And so many renters choose to go on their own, but again, you face many of the same risks as homeowners. And so your landlord has an insurance policy that's responsible for the structural damage to the building, but not the damage or the loss of your personal property. And it also will not protect you from being liable for damage if you cause damage to the building inadvertently, like a kitchen fire, for example, or if somebody's injured by your property itself. And so what does renter's insurance cover? It covers the loss or damage to personal household contents, your possessions. So it can cover anything from your electronics to your clothing, the items that you own in the apartment or the house that you rent. Just remember that even a minimal number of items can add up to thousands of dollars of property. And many policies don't limit your protection to the belongings located in your home or apartment. For example, if your car is broken into and those items, if you have a renter's insurance policy, they may be covered under your renter's insurance policy. It covers additional living expenses. So in a situation where you can't live in your apartment or your home, if there's been a fire and you know you need to live somewhere else for a while, renter's insurance will help you pay for those additional living expenses for the time when you may have to live elsewhere, and as well as the liability coverage. So the coverage for injuries to others or their property caused by your negligence. When you're shopping for renter's insurance policy, make sure that you understand what perils are covered. And so that means a peril is a risk, such as fire or wind or hail. And so is this policy covering me for all the perils that I need it to cover me for? And so just make sure that you understand that when you're purchasing a policy. If the home is damaged by a peril that is not named in the policy, then the damage will not be covered. And just remember that a policy that covers only one peril, like a fire only policy, it's going to be less expensive. Just make sure that you understand what you're purchasing. So for example, we do have an example of some apartments that were damaged in a windstorm in Baltimore, with many of the tenants carrying renters only policies. And this is really important for those of you who decide to purchase renter's insurance. It's important that you have some kind of inventory of your belongings. And we have videos that are available on our YouTube page. So that's the Maryland Insurance Administration's YouTube page that can help you understand, creating a home inventory. And just remember, you can do this. You can take pictures. You could take video. Of course, you can write everything down as well if that's what you're most comfortable with. But it's important to have a list of your belongings, because when you file a claim under your renter's insurance, they're going to make you generate a list of your belongings. And it's going to be a whole lot easier for you to generate that list of belongings if you have paperwork that you can refer to that you wrote it down, or if you just have pictures or you have video. So you can just go through and say, write everything down at this point, and these are the things that you owned. And it will make things a lot easier, as well as making sure that you store them in somewhere safe. So a safe deposit box, a fireproof box, somewhere other than obviously just sitting around in your apartment. Another important thing when you're purchasing renter's insurance, know the difference between actual cash value and replacement cost value. So replacement cost value, an RCV policy, that's going to replace your things with something new. So if your computer is 5 years old and it's only worth a few $100s today, but to replace it new, it's $2,000, a replacement cost value policy is going to replace it new. An actual cash value policy is going to depreciate it. So that computer that's only worth a couple $100s today because it's 5 years old, that's all you're going to get is going to be a couple $100s, for example. Another frequently asked question, when I was a homeowner, my policy didn't cover earthquakes and flood. Is it the same with the renter's insurance policy? Yeah, in general, your renter's insurance policy isn't going to protect you from earthquake or flood. There are additional policies. If you have a particular concern, you can purchase a flood insurance policy and earthquake coverage. One thing I want to go over real quick is policies, renter's insurance policies are usually going to cost you on average right now between $15 and $30 a month. So that's just an FYI. You may be offered by your landlord a property damage liability waiver. And this is just to help you understand what that is. A property damage liability waiver is not renter's insurance, and it typically will not cover any of your belongings. So the PDLW, it generally only covers damage to the buildings. So this is going to be liability for damage that you may have caused. So just to be aware, if you're offered that, you just need to know this PDLW waiver, it's not renter's insurance. It's just an FYI. It doesn't mean that it doesn't make sense for you to purchase it. It just means you need to know it's not renter's insurance. And then I just want to show you one more thing. If you are interested in purchasing renter's insurance, the Maryland Insurance Administration publishes a renter's insurance comparison guide to rates. So this, we try to make it as easy as possible for you to be able to shop for renter's insurance. You can go to our website and you can look at this online, or you can call us and we will snail mail one out to you as well. And so what you're going to see is you're going to see different counties in there. You're going to find the county and you're going to find the zip code that's closest to your situation. And then that is going to show you rates. And so what I'm showing on the screen right now is an example of a page where we're showing the rates for the different renter's insurance. And so that's going to be available to you. And I do recommend it. It helps you narrow down. There's a lot of companies that are offering renter's insurance, a lot. And this is going to be a great way for you to narrow it down and decide the few that you're going to call and actually get quotes from. And again, you can call us, we'll snail mail it to you, or you can find it online on our website. And so with that, this is the link to it. Again, I know you can't click on this, but if you want to send me an email and if you want me to send you this presentation, I can do that as well. I'm gonna go ahead to that's my email address. So if you want a copy of this entire presentation, I know it's cut a little bit short because of our time, please shoot me an email and I will send you a copy of the entire presentation. And you can find on our website, insurance.maryland.gov, you can find a lot more information about renter's insurance. And thank you everyone for the time. I'll pass it back to the Q&A.
All right, great. So there is one question here, Patty, from Deborah Bennett. I wanted to bring this one up. If a renter has hearing aids, is this covered under basic renter's insurance or an additional option that needs to be covered?
You know what? No one's ever asked me that. That's a great question. Sorry, I don't know if that's covered under the basic policy. They should bring it up with the agent or the broker or the insurance company to find out if it's covered or if there's limits on coverage, or if it is a situation where they need to schedule it, that they need to insure it separately.
Great. There was another question too. I did refer this individual to possibly send an email to Chevelle. But this, Chevelle, there's a question about kits that are available for people with disabilities or low income that test for mold. Are you familiar with anything like that? Or could you share links to that information?
Yes, I can share some links. You mean kits that are
Yeah,
available for mold to do testing?
yeah, this person said kits. Yeah.
Yes, they can contact Green and Healthy Homes Initiative, and we will provide them with a kit. And we'll also do assessment for them and possibly have one of our inspectors go out as well
Okay,
to
great.
try to help remedy the situation. So if they can just either email me or email info@ghhi.org.
Okay, great. All right. I'm going to allow my phone people to talk. I have two people who are calling in on the phone, one calling in from a 202 number, the other from a 443 number. So I have you unmuted. But I believe are we good now to take some question and answers from the audience? If anybody has some final questions.
I have one. We've talked a lot about disabilities. Could you give me a definition of disabilities, what that includes?
So the definition is different depending on who you talk to in terms of like different programs. So the programs that I talked about, that is based on the HUD definition. And I did provide a link in the chat. I know you're calling in, but just to give you an idea of what we're looking at, we categorize based on physical disability, behavioral health disability. A person might have an auditory or a sensory disability. So it is fairly broad, but the HUD definition is what really goes into it. And that's also pretty detailed. So really the main criteria is an individual who has a physical or mental impairment that substantially limits one or more major life activities. They have to have a record of the impairment, and they have to be regarded as having an impairment. So there's a whole list on HUD's website of what this may entail. Could be a developmental disability, a mental illness.
Okay, you gave me my answer. Thank you.
Okay, great. Okay. Anyone else? Oh, Denora. All right, Denora, I have allowed you should be able to unmute.
Yes.
Perfect.
Okay. First of all, I apologize. I'm just coming into the Zoom, so I have missed everything. I wound up with another meeting that I wasn't aware of that I had to be in. So is there any way I can get a copy of what transpired today?
Most definitely. I have been recording this session and we will be posting it up on, we can either post it on our YouTube page, or I can send out a link to the recording to all the
Okay.
participants. Yeah.
Okay. So you all will have my email. You can send me a link.
Yes. If you registered through the Eventbrite and everything?
Yes, I did.
Yeah, we should be able to get that link out to you.
Okay. Denora Brown, thank you so much. I'm so sorry I missed this. I really needed it.
That's
you.
okay. It's all right.
Okay.
Anybody else? All right, Sharia.
Hey, hi everybody. I asked a question earlier, but I think maybe I missed the answer about, I tried to get when I call social services about the voucher program or Section 8, they tell me it's closed, I can't apply. How can I'm disabled, how can I get a voucher or get some help? Because I'm paying full rent. I really can't afford it. Not the backed up anyway.
Yeah, sure. So, sure, yeah, I'm gonna ask if you, do you do email and everything?
Mhm.
Okay. Can you send me an email to the email address I provided earlier? Do you have that?
Is this one?
It's housing info.
Yeah, I think I wrote it down. Let's see.
I'll put it in the chat too.
Okay.
So send me an email and we can catch up, because I think the first step sounds like maybe getting you connected to some case management services if you're not already
Okay.
getting that.
No, I'm not.
Okay, yeah, then we should chat.
Okay.
Anybody else? You can, if you're on your computer, you can raise your hand, by the way. I don't see any other hands.
Chelsea, I just put the survey information in the chat.
Oh, great. Thanks. Thanks so much, Patty.
Hello.
Hey, Denora, I still have you on. Did you have a question?
I do.
Oh, great. Okay.
Yeah. Like I said, I missed everything, but if we do have issues or problems, we need to probably contact someone in reference to, would it all be a part of what you'll be sending out today?
Yeah, so typically at the end of the different presenters' presentations, they included their email addresses. So you'll, like, usually it's like the last slide, you'll see the email addresses for each of us.
Okay, if we need further questions or answers, questions that we might have.
Yes, yeah.
Okay. All right, thanks again.
Not a problem. Oh, okay, got Carol. I believe I have you. There you go.
Hi, so I sent some anonymous messages about a client of mine. I'm a social worker. So who would I best contact to try to get some help resolving her issues?
Is this a client you're working with that has a disability that needs housing assistance?
It's kind of complicated, but yeah, she's got severe mental health issues. She's not designated disabled, but she's got a 3-year-old. One of her twins is. She actually was evicted while she was incarcerated, and they didn't bother to take her to court, and they've closed up her place, but they haven't moved her stuff out. It just seems kind of fishy to me, and they won't let her back in. She's got severe mental health issues, and because of that, she's got a criminal record, but it's all related to mental health breakdowns. So, she was homeless. I got her into a living shelter place, and they evicted her right away. So she's right now just hanging out with someone else. But I need to get her into some housing. I need to figure out if she was legally evicted.
Yeah. So it sounds like a combination of me and Robin, probably. Yeah.
Carol, for in terms of determining whether it was an illegal eviction and what steps to take if it was to resolve that, I'm going to refer you to our tenant advocacy program. The quickest way to get in touch with Carol, who is the director of that program, is to fill out an intake form online. We do have a phone number you can call, but it is only staffed for a few hours, 2 days a week. We really strongly recommend that people use the online intake form. And you can get that at www.fairhousingmd.org. It'll be ask a housing question is the link that'll be right there in front when you go to that website.
Can you put that on the chat or somewhere? Because I'm having a little difficult hearing.
I sure can.
Yeah, and Carol, we should connect as well after this presentation. I believe the general email I provided to everyone, but if for some reason you don't get a response, my email is just my first and last name, chelsea.heyman@maryland.gov.
Okay.
So you can send me an email there as well, because it does sound like it sounds like she could be a potential good fit for one of our programs. We can chat a little bit further.
That would be awesome.
Yeah, especially, I mean, so like with the criminal background, the other thing that I just want to mention is, depending on what the circumstances are, just having a criminal background doesn't automatically disqualify you necessarily from our housing programs. It depends on what the property's criteria is. So if it's a disability related incident, then that's something that a reasonable accommodation could be requested for, so we should chat about it because it sounds like it's a little bit more complex of a case.
Okay.
Yeah, but happy to do that.
And Carol, that link is in, I sent it in response both to your question and it's also in the chat to everybody.
I appreciate it.
Mm-hmm.
Thanks.
All right, I have, Sharia, did you have another question? I have you as your hand raised. I don't know if you had another question.
Oh, no.
Okay, that's all right.
Sorry.
No, you're fine. Barbara Tunstall.
Yes, thank you. I have a question about the Green Housing Initiative. Is that just for people 65 and over and people with children, or are people with disabilities included in that as well to get an assessment for hazards in the home?
It's for anyone. So it's for people with disabilities and non-disabilities. So if you give us a call, we'd be more than happy to do that assessment for you. And if we can assist in any way, we'll do. Right now, since we haven't been going inside the home, we're doing virtual home assessments. So we will walk you through that process as well.
Okay, great. Thank you.
You're more than welcome.
All right. Any other questions from the audience here? Please raise your hand if you're joined by computer. I can unmute you. All right, well, I'm not seeing any other questions, but we are certainly available after the presentation. Should anyone have follow-up questions about the information that was shared here today, I want to thank all the panelists for joining us today, Robin Dorsey, Patty, Dorn, and Chevelle. Thank you so much for your presentations. They're very informative. James, did you want to add anything to send us off?
I'd just like to thank everybody for participating today, and you guys did a great job. Thank you.
Great, thanks so much. All right, well, take care, everyone, and we really appreciate you taking time out of your afternoon to join us. Have a good rest of your day.
Thank you. Everyone be safe.
You too.
Thank
Bye.
you. Take care. Bye-bye.